Hello everyone. Good morning. Welcome back again. Of course, I just finished filming a video and I just wanted to do a little chit chat. I know people have said, oh, do I need to be smart to go into nursing school? I've seen a lot of videos on this. People ask me personally, how was school? How are you able to cope? Was it not too hard? Was it not too stressful? All of this, Yes, it's true. It was stressful. It was hard. Going to school is hard. It doesn't matter what program you're doing. Whatever you choose to do in life, there's always going to be struggles, challenges, whatnot. Okay? But this video is to give you a lot more encouragement in your different career paths. People say, do you have to be smart for nursing school? No, you don't have to be. Knowledge is not measured just by academic grades. No, it's beyond that. It's beyond the classroom. Knowledge and wisdom is measured on a variety of skill. It depends on wherever you put yourself on the spectrum. But what I'm trying to say is that you do not have to be smart to go into nursing school. You do not have to be smart to be very, very successful, very emotional, empathetic nurse. And all of you who feel emotions that, oh my goodness, nursing is horrible, it's stressful, there's a lot of negative and positive emotions at the same time. That's okay. Sometimes myself, I feel overwhelmed. I felt overwhelmed a lot of times in school. Even in my career, there are days where I feel like, no, I'm not up for this. I'm not doing this. I'm done. I'm tired, But at the same time, at the back of my head, I still know, well, I still like this. I still have a lot of passion towards this and whatnot. I like learning. I like knowledge. I like, critical care, stuff like that. But what I'm trying to say is that no matter what you do, you're not going to fully be your best at it 100% of the time, because there's always going to be challenges and obstacles, and that's just part of life. This whole imposter syndrome, decreased confidence, pretends to be who you're not just so you can get your way out, or you can make it, fake it till you make it. I don't know, that saying doesn't really work well with me. There's no need to fake something until you make it, because you're either making it or you're not making it. But what I'm trying to say is that it's okay to feel overwhelmed. It's okay. That imposter syndrome, it's fine. It will come, it will go. There is no running away from emotions. Those are totally normal, okay? Sometimes it takes time to build confidence. It takes time to build yourself as an individual, let alone a career where you're dealing with a lot of people. I had zero confidence in my nursing skills back when I was a student. I'm not gonna lie about that. I was very smart. I would say I would pass exams. I would really do well on my nursing exams. But when it came to the practical components, when it came to clinical setting, when it came to engaging with patients, there were times where I would be so timid, different ways, how we communicate in my own ethnic group, my own circle is not the way I'm able to communicate with those people, which is a valid feeling, it's a valid emotion. But what I'm trying to say is that it comes and it goes, but it gets better. It's always hard. It's gonna get harder and harder and harder before it starts getting better and better. And by the time you see yourself doing it a lot of times, you're just putting yourself into that situation more and more and more. You see yourself there's this what do they say? What do they call it? You become, there's what we say in medicine, you become immune. You become immune to that environment. Nothing stresses you out anymore. It's oh, what's the worst that can happen, right? It's always what's the worst that can happen? You're just immune to it. You put yourself a lot in there that there's no fear anymore. So you don't have to stress yourself so much. If you have issues with studying, retaining information, sometimes it does come with time, and sometimes it just takes you to be patient with yourself, trying out a lot of different study strategies, okay? You have to try a lot of things to see, okay, what's working, what's not working, and weed out whatever is not working. Ask for help, ask your friends for help. I know people sometimes send me DMs. I may reply a lot of times, and sometimes I may be slacking because life is really busy as well. But what I'm trying to say is that just put yourself out there, put yourself in uncomfortable situations, and sometimes you just find yourself being comfortable without even knowing how you got there. You just looking back at nursing school versus where I am now, I know that there's been a huge change, huge difference in terms of my growth on a personal and a professional level, which I really noticed, and it's very nice to know that I'm in that area of my life. So for any of you watching this video, I just wanted to do a quick chit chat to all my nursing students out there who are still going to school. I graduated last year, June, right? And I've worked across different places. I've had major challenges at work, but I would say that I have grown in ways that I never imagined that I would grow to or I would get to. And what I'm trying to say is that you're not alone on this journey, okay? You're not alone. There are some people who try so hard but they can't get it, and they end up, you know, dropping out or switching to different programs. It's okay. It's totally fine. You don't have to always do what you want to do. Doesn't mean that that's what you must do in your life, right? Life can always change. You can always make spontaneous decisions. And the fact that, let's say you started this year and it's taking you maybe 6 years, 5 years, 4 years, 7 years to finish your nursing program, it's different for everyone. People have their own like struggles along the way, how they get back up. You know, there's a lot of factors. There's always going to be a challenge in whatever you do. It depends on how you decide to face the challenge, okay? Things can get very worse before it gets very good, okay? So you're never gonna be stuck at one point. So the point I'm trying to make in this video is that you don't have to feel like you're smart every day. It's fine to fail. I'm sure I've failed exams before in my life, but that doesn't matter. It doesn't change anything about me, about my life, about my knowledge. You know, sometimes you just fail because, oh yeah, it just wasn't a good time, or different reasons. But don't beat yourself about it. It depends on how you stand up, how you decide to move forward, and how you decide to live your life going forward, okay? So that is what this video is about. And if you want to chat, have a one-to-one session, feel free to leave comments. I've looked at my schedule and I have a bit of time. I'm sure it's gonna get busy or get full before I know what's happening. But in saying that, I'll be happy to chat with nursing students, anyone watching this video that just wants to talk about school, and you know, you have a lot of questions, feel free to ask me. My Instagram, my Facebook, you can always send me DMs and I will look at them and respond. Try to respond in a timely manner, okay? So that brings me to the end of today's video. Thank you so much for watching, and I hope to see you on my next one.